My name is Katrien, Katrien, Milne, Milne. My student number is 102-833-225. This is my Seneca ID, and I'll be performing my head-to-toe assessment on a patient. This is a 3D scan of the room. My sister will be my patient for today. Just in case you hear any noises, I have an outdoor cat who might scratch on the windows. I'm sorry. And I have 3 dogs in the kitchen. Hi, my name is Katrien. I'm a student nurse and I'll be doing your physical assessment today. We're doing this because you had a fall 2 days ago. And we're just going to check up on your physical health to see if any interventions need to be done. Are you in any pain right now?
No.
Do you need to use the washroom?
No.
Okay. I'll close the curtain for patient privacy. I'll do hand hygiene and don clean gloves. And then I will sanitize my stethoscope. Okay. Can you please tell me your name and date of birth?
Emma Milne, January 24th, 2001.
Okay. So upon general inspection, patient is 22 and skin color is Caucasian and consistent throughout. She has a muscular stature, has symmetrical body position, her posture is erect and no involuntary movements, and she has no obvious deformities. Judging by her face, she has a neutral facial affect. She is in a calm mood. Patient maintains eye contact well, and speech is relaxed. Can you please tell me your full name again?
Emma Milne.
The name of the hospital we're at?
Royal Victoria Hospital.
And then what time of day? So around the last meal we had.
Dinner.
Okay. Patient is Lorton-oriented ×3. There's no laborious breathing. So I'm going to continue into assessment. So starting with the face, color is consistent with the patient's ethnicity, so no redness or bruising. Facial features are symmetrical. There is no visual signs of edema. And skin color is soft and warm to the touch. No edema. So I'm going to continue with cranial nerve number 7, facial nerve.
Sorry, there's a mosquito.
All right. Facial nerve number 7. So I'm going to have you copy the faces that I'm making, okay? So smile, frown, show your teeth, scrunch your eyes tight, don't let me open them. Okay, and can you raise your eyebrows and puff out your cheeks? Don't let me press the air out. Okay, cranial nerve number 7 is intact and functioning. Movements are symmetrical and strong. So I'm going to move on to the ears. So upon inspection, there are many piercings present, all in good health. Placement is symmetrical and there's no excessive discharge. Looking at the eyes, eyelash distribution is even throughout. Eyebrows are present and symmetrical. There is no signs of edema or lid lag within the eyelids. Sclera is white in color. Can you look up? Conjunctiva are pink in color. I'm going to continue with assessing cranial nerve number 3, oculomotor. Actually, so look at me. Pupil size is 8, which is fine. The room is dark. Both pupils are round and symmetrical in size. I'm going to test reactivity to light. So look at me, look at my nose. Both pupils are reactive to light, so I'm going to test consensual reaction. Consensual constriction reaction is present and intact. I'm going to assess accommodation, so look at the tip of the light. Eyes converge symmetrically bilaterally, and pupils constrict upon convergence. Oculomotor number 3, cranial nerve number 3, oculomotor is intact and functioning. So looking at the nose, 2 nostril piercings are noted on the right nostril. Can you look that way? They're present. Look at me. There is no excessive discharge, and nose is midline. Looking at the lips, they are pink in color and hydrated. I'm going to continue with assessment of cranial nerve number 9, glossopharyngeal, and 10, vagus nerve. Open your mouth, please. Say ah, ah. Soft palate rises. Cranial nerve number 9 and 10 are intact. So assessing cranial nerve number 12, hypoglossal. Can you open your mouth? Put your tongue up to the roof of your mouth. Stick it out. Go to the left. Go to the right. Okay. And say light, tight, dynamite.
Light, tight, dynamite.
Cranial nerve number 12, hypoglossal, is intact and functioning. Okay. So moving on to the neck. Upon inspection, color is consistent with the patient's ethnicity. No visual signs of edema. Pulsations are observable. No obvious enlargement to the thyroid. Trachea is midline, temperature is warm, and there are no involuntary movements, and skin is soft and hydrated. So I'm going to continue with palpating the carotid arteries. Carotid pulse is present and equal bilaterally, 2+ strong with a regular rate and rhythm. So we're going to test cranial nerve number 11, spinal accessory. So I'd like you to copy my movements. So shrug your shoulders up, hold them there, don't let me push them down. Right. 5+ strong, equal bilaterally. And can you look to your right and then to your left? Okay. And then can you press against my hand? And the other side. Okay. Muscle strength is 5+ strong against gravity and full resistance, equal bilaterally. So I'm going to continue with assessing the rest of the body. So with the upper limbs, I'm going to expose the shoulders. Okay. So upon inspection, stature of the arms is muscular and bulky. Hair distribution is even throughout. There is a tattoo noted on the left forearm in good health, and no visual signs of edema. So I'm going to continue with palpation. Is there any pain?
Nope.
Okay. Skin is slightly cool to the touch, but not concerning. Skin is soft to the touch, no edema. Can you bend and straighten your elbows? Right, no signs of crepitation. So assessing the radial pulse. So radial pulses are present and equal bilaterally, with a regular rate and rhythm, and 2+ strong. Okay. And can you squeeze both my fingers? Grip strength is strong and equal bilaterally. So moving on to the lower limbs. Upon inspection, legs are shaved, stature is muscular and bulky, color is consistent with the patient's ethnicity, so no redness or bruising, no obvious edema, and I'm going to continue with some palpation. Is there any pain?
Nope.
Okay. Skin is warm to the touch. Can you bend and straighten your knees? So crepitation with an audible crack in the left knee is palpable on both knees. And the musculature was bulky. I'm going to continue with assessing the respiratory system. So with the anterior chest, what I would do is ask the patient to reconfirm pulse, and I would count respirations, holding that for 30 seconds. I'll be skipping this for the sake of this assessment. So I would count. Okay, Respirations are 16 breaths per minute with a regular rate, relaxed and deep breaths. Okay, so I'm going to assess the posterior chest. Can you please face that way? So I'm going to be exposing your back. Okay, is that all right?
Yep.
Okay. So upon inspection of the posterior chest, a tattoo is noted on the around the cervical and thoracic spine area in good health. There is no discoloration. Rib cage is flat, and there is a symmetrical rib and rib markings and scapula. There's no obvious masses. So I'm going to continue with palpation. Any pain?
Nope.
Right. No obvious masses, no pain or tenderness. Okay. Take a deep breath. Rise and fall of the chest is symmetrical and skin is soft to the touch. I'm going to continue with auscultation. So every time I place the stethoscope down, I'll have you take a deep breath, but do it in a relaxed way at your own rate, okay?
Yep.
Bronchivesicular sounds and vesicular sounds are audible, no wheezing or crackling, so there's no liquid or constriction. Constriction of the bronchioles or liquid present in the lungs. Breath sounds were deep and relaxed, so chest is clear. Okay. I'm going to have you come and face me again. So I'm going to continue with assessing the cardiovascular system. So I'll be auscultating the apical pulse area, and that is the mitral valve. So along the left side of the chest, the midclavicular line at the fourth intercostal space, or the fourth or fifth, I'll be auscultating. Okay. So I'm just going to displace your breast, okay?
Mm-hmm.
At this point, I would count for 30 seconds to get a pulse rate. I'll be skipping this for the sake of the assessment. Pulse rate is 70 beats per minute. Rate is regular. Heart sounds are 2+ strong. Okay. S1 and S2 are audible. There are no additional sounds, so no S3 or S4, and there are no irregular sounds of the heart. I will be continuing with the abdominal assessment, so I'm going to have you lay down on your back. Okay. So I'm just going to expose your abdomen, okay?
Yep.
So I'm going to drape the patient's waist. And then the patient's chest. For your vantage point, so you can see my work, I'll have the patient just hold the phone. Okay. So upon inspection of the abdomen, it is symmetrical. Contour is flat with some bulky musculature. Umbilicus is midline. No obvious edema or distension, and color is consistent with the patient's ethnicity. I will be continuing with auscultation. Okay. High-pitched gurgling sounds are audible in all 4 quadrants within 5 seconds, so bowel sounds are active. I will be continuing with palpation. Is there any pain?
Nope.
Let me know if any pain occurs. So no pain or tenderness, no palpable superficial masses, no edema, and no distension. And skin is soft and warm to the touch. And that concludes my assessment.